is when it comes to heart disease, because up until probably the 1990s, there was really never a concern about the impact of heart disease on women. All the studies have always been around the impact of heart disease on men, starting with the Framingham study. However, women started dying at such a fast rate of heart disease that it took a few pioneers in cardiology to really bring awareness to heart disease in women. So one of the most notable pioneers is I believe her name, Dr. Jennifer Mears, one of them. She was a cardiologist, and she started raising some awareness about the fact that for women, the primary doctors were not really focused on anything above the waist. So everything that was managed was usually below the waist. So they were concerned about breast cancer, but not really the person's heart. And so there was no education about staying active or managing your diet, losing weight. You know, back in the 90s, before the 90s, women were never counseled on these things. And I don't know if it was because it was thought to be rude, if a provider would start talking to women about losing weight. I don't know exactly what it is. So anyway, make a long story short, Dr. Jennifer Mears was one of the board directors. I think her name was Mears. Dr. Jennifer Mears. Anyway, she was one of the board directors on the American Heart Association, and she started bringing awareness to the plight of women dying of heart disease. And so studies in the 2000s started concentrating more on, started concentrating also on the impact of heart disease on women and the fact that women were dying at an alarming rate. Back before the 1990s, 1 out of 3 women was dying of heart disease. And so now, with much improvement in the research, thank you to, and the reason why I keep focusing on Dr. Jennifer Mears, and I believe I'm going to get her name when I upload the video, I'll put it correctly, but I believe her name was Dr. Jennifer Mears. The reason why I keep mentioning her because this is also Black History Month, and she was a black cardiologist. And so she really brought awareness to heart disease in all women. And she focused a lot on African American women, because if women were dying out at a higher rate, African American women were dying at an even higher rate. So some of the research started focusing on black women and women in general health, and trying to see what can be done to prevent heart disease in women. So it started off with research. Like, the thing is, the word wasn't getting out to women. And so one of the things that Dr. Jennifer suggested was to do direct marketing of the impact of heart disease on women and why women were just dying. And so we started a lot of campaigns, like the Go Red campaign, to raise awareness. There was this red dress campaign. message about heart disease and prevention of heart disease. And that included doing some preventing stuff such as exercising, just walking, staying mobile, not sedentary. Also, eating a healthy diet, okay? Making sure that we eat a diet low in fat, low in cholesterol, and low in sugar to keep ourselves healthy. Again, we repeat the not smoking, okay? Because smoking has a negative impact on the heart. We also talk about decreased alcohol consumption, okay? And I had to do some upper body movement because it's very hard to really move in these seasons or on this beach, but it's wonderful. So I'm so glad that we were able to just enjoy some of the sun today. And it's a beautiful sea. So I'm not getting in the water, but maybe later on this week I'll be able to. But anyway, so getting back and just increasing your stress level, making sure that you take some time out to de-stress, to center yourselves, okay? Remove the stress, bring in the calm, wake up with a heart full of gratitude, and that's one of the ways that you can de-stress. Also regulating your blood sugars, keep your blood sugars under control, know your numbers, keep your blood pressure under control, and like I told you, I like to see your blood pressure around 130/80, so make sure that you can keep your blood pressure at a good level. Woo! And so, it's great that wherever we are, we can take the time out to raise awareness, right? Try to do a little bit of education, and also because it's Black History Month, I wanted to take the time out to shout out Dr. Jennifer Mears, who was one of the pioneers in raising awareness of prevention of heart disease in women as a whole, because women are dying of heart disease at an alarming rate. And some of the marketing campaigns have worked. Women are paying attention, but we still have a long way to go to make sure that not only are women aware, but primary care providers are aware that sometimes symptoms of heart disease in women are not the same as men. Women don't get that crushing chest pain. So women can have